So, exciting day today, honey.
It is an exciting day.
Yeah.
The weather doesn't look so hot, but it's a great day.
Okay, so we will be talking about immunity. Okay, so if you talk about immunity, honey, what's the first thing that pops out in your mind?
The immune system.
So very good.
And immuno surveillance.
Okay, so the immunity, it protects us. So you have your specific, non-specific. If it's non-specific, it pertains to your skin, to the secretion of your eyes. So if there's an offending organism, probably some bacteria that will go inside your body, the first line of defense is your non-specific areas, which are your skin, your mucous membrane.
You want me to talk about the immuno surveillance?
Not later. We're gonna talk about that.
You got a great example.
Okay, you tell.
Okay. Basically, what immunosurveillance is it's your body's innate ability to identify bad cells in the body, and it basically will take them out with natural killer cells. What it's like, I want you to imagine, it's like police out on patrol. And as these cops are out on patrol, they're looking for bad guys. And when they see these bad guys, they take them out. Okay, and these bad guys in your body would be aberrant cells, cancerous cells, things like that, bacteria and such. What happens, though, oftentimes with immunosurveillance, is as we start adopting more of a really unhealthy lifestyle, we start developing a lot more inflammation from the foods we eat, from our lifestyle habits. You know, it could be the perfumes we're putting on, the makeups that's getting put on, the lotions that's getting put on, the highly inflammatory foods. At that point, the immune system is very, very active, trying to put out these fires of inflammation. And what that means is the immune system is out doing things that instead of out there looking for bad guys to take care of them, instead of doing that, the immune system is out shooting dice, they're out playing cards, they're out hanging out at McDonald's, they're out at the cockfights, doing things that basically are not benefiting us from a immunologic perspective. They're just basically putting out the fires of inflammation. So, as Dr. Farrah has clearly demonstrated over the years, if we can put out the fires of inflammation, if we can limit these persistent lifestyle and organic pollutants like what's in our house, what we put on our skin, dietary pollutants, the things that we're eating, then the immune system can really get an opportunity to go back to work and do what it does best, because the immune system was basically made to really do specifically one really good thing. That's to kill things.
To kill things
that our body does not need.
To kill offending organisms and anything that is foreign inside our body. That's actually the specific. It's a more specific. These are your lymphocytes. So, if you have your CBC and you take your CBC, you have the lymphocytes, the neutrophils, the eosinophils. So these are just cells. We call them polymorphonuclear cells, and they are there for certain reason. Okay, for example, there's a bacterial infection, and you do your CBC, diba? You check your CBC, and then you look at the neutrophils and they're high. It says that your blood is telling you that there's a bacterial infection. Now, if there's a viral infection, your lymphocytes will be higher. Okay, if there's a parasitic infection, your eosinophils are getting higher. For all of you who are sick, diba? Sometimes you're telling me, Doctora, can you read this CBC? And then you would tell me, you would look at it, so you will know, just by learning and watching this video, you will already know that, this is high, so most probably I have some bacterial infection. But we're gonna be talking about immunity, the third stage, that's what they're calling, or the third phase of immunity, which is your passive and your active immunity. So this is more about vaccination, about having an infection, an innate infection, antibody introducing into our system. So you have two types of immunity. You have your active immunity and you have your passive immunity. So if it's an active immunity, okay, since we're gonna be talking about childhood illnesses right now, if it's an active immunity, an antigen is being introduced in our body, okay, either through vaccination, or second is either through contact. So nagkasakit ka, okay, so those are the two types of active immunity. You have your natural, in which you got sick. For example, you had measles or you had some form of hepatitis. Okay, so nagkaroon ka, that's your active immunity. Okay, that's your natural. And then you have your artificial immunity, which is through vaccination. And we're gonna be discussing, I'm not gonna go thoroughly through vaccination because as all of you know, I did not vaccinate my children. So, and there's a reason why I did not vaccinate them. So again, we're gonna go to active immunity. So this is lifelong. So once you get this type of infection, then infection, you would have some sort of, according to some literature, it's almost lifelong because there's still an incidence or there's still cases that have had reinfection. So it doesn't really confer 100% immunity. Although in some literature, they say it's 100%. But some people, they had measles and then they will have measles again. Okay? And it's because of the nativity or the nature of the virus. Some virus, they have undergo some form of mutation. Okay? And that's very normal for them, for a virus to change its genetic structure. Okay? So that's your active. So again, it's an antigen, it's lifelong, there's a memory for that. And you have two phases. You have your primary response, in which when you get the infection, you will not develop immunity first. The second time that virus comes in contact with your body after the primary response, then more or less your body can fight it already. So that's your active. So we're gonna go to passive immunity. The passive immunity talks about antibody. So there's no antigen here. The person has not been exposed to any antigenic stimulation. This is all about antibody. Yes, there's no illness.
Careful not to talk too medical, Mom.
Yes, so there's no illness. For example, passive, you have your natural again and your artificial. Of course, artificial, it's vaccination. So you're gonna be giving antibody like tetanus toxoid. So you have anti-sera, they call it. And some people, they're allergic to the anti-sera, so they would form a severe case, which is serum sickness. So again, so we're gonna go to the natural. The natural, it's the introduction of an antibody, either by maternal antibodies, and maternal antibodies transfer going to the infant, okay? Or through breastfeeding. That's why it's important to do breastfeeding.
Mm-hmm.
Yeah, I breastfed my children for almost, I think my youngest, it's 3.5 years.
I breastfed to when I was like 24.
You were 24. Okay, so that's very important. Okay, again, for the passive, it's an antibody. And the response is rapid. Okay, in contrast with the active, the response is you have a primary response and secondary response. But with the passive, it's immediate. Okay, you introduce antibody, it's immediate. However, the effects would only last for a few days. Okay, so that's how the active and the passive immunity is, and I hope that you understood. Okay, that's the most important. Now, we're gonna go to childhood illnesses. Okay, how about you, honey? What do you think about childhood illnesses?
Well, I wasn't an alcoholic as a child.
No, okay. No, we're not talking about alcoholic, okay, Sir Jack, or smoking, okay?
I'm kidding.
So, with childhood illnesses, the more common, these are your measles, diba?
Measles, mumps, rubella, scarlet fever,
Yeah.
chickenpox, things like that.
Yeah, but I'll be talking about just a few, okay? Because we only have 1 hour to tackle it. So, again, we're gonna be talking about the most common. What's the most common is mumps, okay? So mumps, or we call them Rubella, okay? This is a mumps virus, okay? The family of Paramyxo. The genus is Morbillivirus, okay? So the thing with the mumps, okay? These are generally mild diseases. So, it's very uncommon, but it happens, okay? It's very uncommon that someone dies because of measles. Mm-hmm. And it's usually because of a complication. Because the measles virus, they can go to the lungs, they can go to the intestines, and they can go to the brain. So, the mumps virus, sometimes you will have children that will have pneumonia, that's why they will have cough. And then they would also have diarrhea, and of course encephalitis. These are the less severe. This is you don't see them. It's not a typical finding, okay, unless the immune system of the infant or of the child has been really compromised. Then you really see them, okay. Now, what are the cause, okay, and the mode of infection? Mode of infection usually by air droplets. So if I sneezed on Sir Jack, I sneezed on him, okay, the virus will stay in the air for 2 hours, and then someone picks it up, and those virus will enter into the nose and enter through the mouth, okay, and then you can have an incubation period. So the incubation period would last up until 10 to 14 days. So you will have an incubation period, and after that you have a prodromal symptoms. Prodromal symptoms, you would have fever, you have conjunctivitis, coryza, that's what your cough and colds, okay? So you have these typical symptoms, okay? That's the prodrome. And then you have an enanthem, that's what they call it. It's just like a spot, we call it Koplik spots, which you can see at the buccal mucosa, dito sa oral mucosa in the mouth. So that's the Koplik spots. And after that, you will have exanthem, which is an erythematous rash. So they're reddish, okay? They can be macules, papules, that's what they call them, because it's just flat, okay? And after that, generally, if there's no problem, the immune system of the child is good, then the child will recover. So me, I remember having measles like twice in my life. So it's not also true that if you had the measles, that you will never have measles.
Same with chickenpox.
There are incidences that you already had measles and you will have measles again. So it doesn't confer 100% immunity. Unlike with all the books that most of the books that I am reading, they said that it confers 100% immunity. So there would always be.
Well, there are times where you have something once in your life where you will never have it again.
Mm-hmm,
like for example, when I was about 7 years old, a babysitter fed me beef liver, and I've never had that again.
Well, that's different.
She said I wasn't getting up until my plate was cleaned. I took that and I stuck it in my pocket.
Now, for the herbal remedies for that, again, okay, this is my caution to all of you. If you have any form of viral infection, do not give aspirin to your child, okay? Do not give aspirin to your child if it's a viral infection. There's gonna be a complication for that. We call it Rice syndrome. And it's very vicious. It can cause liver problems, so do not do it.
Let me ask you this one. In a situation of a viral infection, is there any benefit at all to giving an antibiotic?
No, you cannot. But the thing is, if you have some form of viral infection, your immunity might be lowered, okay? And then if your immunity is lowered, then you are susceptible to some bacterial infection. So,
but if there is no bacterial infection,
if there's no bacterial infection, you should not be giving an antibiotic. You should not receive an antibiotic. So for a fever, the best thing to do is you can have this ampalaya juice and then you drink them. You can give it every hour, 3, 4, 5 times a day. So you can give that to the infant or to someone who's suffering with fever. Again, also, you can do a compress using...
Cold compress.
Yeah, cold compress. Or you can also use compress using white vinegar. So you get a towel, you put some white vinegar on it, and then put some compress in the infant or in the skin, so to lower the temperature.
Cleaner skin too.
Yeah, and cleaner skin as well, according to Sir Jack. So, and then if you have conjunctivitis, okay, so reddening of your sclera, so you can use honey with distilled water. Okay, make sure that the honey is sterile as well, and then a sterile distilled water. So usually it's a few drops of honey and then 5 ml of distilled water, and then you can apply that 3 or 4 times in a day. That's for the conjunctivitis. For the cough and colds, you can use oregano, cinnamon, eucalyptus. Again, honey should not be taken internally by infants less than 2 years old because of a condition known as infantile botulism. So we do not have, they do not have the necessary equipment, immunity, to fight that type of infection. Okay, so next would be your German measles. So German measles, it's a mild measles. We call them rubella. Okay, so measles, measles, it's rubiola. This one, it's German measles, rubella. These are quite mild, and you can see them. They usually have lymphadenopathy. And German measles would have fever as well, but again, it's mild. Usually around 3 days, they would be gone. So you would also have some form of a rash. But the thing is, okay, this is only important. German measles is only important for a pregnant woman, because if you have been exposed to this virus, you would have congenital rubella syndrome, in which the infant, okay, if you are pregnant and then your infant, you will deliver to your infant, you will have, the infant will have mental retardation, sensory neural deficits, blind, usually blind and deaf, they cannot hear. That's why it's important that you stay away. Okay, if you're pregnant, you stay away
from sick people. Yeah,
from sick people. So that's how German measles is. Next is, of course, your favorite, honey, chickenpox. It's his favorite. No, I'm not. I'm joking. So chickenpox. Our children had chickenpox. Do you remember?
Yeah.
Gabby and Henry.
Yeah.
So the first time that they had the chickenpox, Gabby. Okay, it was only in a few selected areas. I think it was only in the legs, you remember?
Yeah.
It was also only in the legs, and then some part of the body. And then after that, Henry had chickenpox. Okay, now the most distinguishing factor for a chickenpox is a blister. So if you look at their lesions, it's like a vesicle fluid-like. Okay, fluid. It's like a vesicle, and then it's itchy. It's itchy. Okay, and then after that, usually after 5 days, they become a scab, and then they just fall off. And after that, most of them, they don't leave a scar, but some they leave a scar as well.
If you bust open that blister.
Yeah. So the thing is, if you're suffering from chickenpox, again, you know what to do when you have fever. Now it's itching. The best thing you can do is that you take a bath using Epsom salts. Okay, so you have 1 cup of Epsom salts, it's magnesium sulfate, you put it in water, and then you immerse yourself, okay, so the itchiness will be alleviated. Another home remedy that you can use is aloe vera. So you get an aloe vera, you bust it open, okay, you slice it into 2, and then you get the gel, and then you get the gel, and then you just put it in your body. Another can be zinc oxide. If you have zinc oxide, it's available in some pharmacies, in shops and everything. So you can just use that, and then you can apply it on the skin. So that would alleviate some of the itchiness. Okay. Now the problem with Varicella-Zoster, okay, which is your chickenpox, some of them, they stay dormant. Okay. When you talk about dormant, they sleep, okay? They sleep in the nerves, okay? We call them dermatomal. So when something happens, you get stress, there's burns, or some form of immunity that would lessen your immunity, then you would develop shingles, okay? So it's like chickenpox as well. So you can see they would be vesicular, but it will only appear on the dermatome. It's like a patch. It's all gonna be that's a distinguishing pattern there. Okay, it's like a patch, and it's very painful. You can you call it post-herpetic neuralgia. My dad had it, and it was so painful. It took around 6 months before the pain goes away. So, but it will stay there. The lesion will usually stay for around 4 weeks. Okay, and then you can put again white vinegar, honey. Okay, these vesicles are infectious. So like with the Varicella-Zoster, you can infect through respiratory droplets, and also with the vesicles. So be careful, do not touch it, because it has some viruses on it.
Somebody's scratching on it.
Yeah, so That's another childhood diseases. Another childhood diseases is the most famous. What they call that, honey? Mumps.
Smumps?
Mumps.
Mumps.
Did you have mumps when you were young?
Probably at some point. I just don't recall.
Okay. I remember my mom. I had mumps. I just do not know. For every one of you who knows what it is, I remember when I had mumps, and then my mom put some blue thing here. I just do not know what it is.
And I mean, I used to be real. I used to have a really bad memory. Now I just forget things.
I think they put some blue. They put some blue object here. It was a paste that they do, and to alleviate it. I do not. Yes, Becky, moms. I just do not know what you call them. Do you know? Yeah, object? Do you know? They put a blue thing here. Agnel color blue. I do not know. I have to do my assignment. I do not know what Agnel color blue is. Yeah, so they put it here. And again, with mumps, it's the mumps virus, of course. It's another part of the paramyxovirus. So they put something here when I was young. So you have bilateral swelling of the parotid. Yeah, Tina daw. Tina yung color blue. Yes. So, okay. So you tell me later because I'm very interested on what is that. But I remember my mom putting that in my parotid. So again, with mumps, you have bilateral parotid swelling, and again a lymphadenopathy. So these are generally mild, and the people that are usually infected are 2 years old up until 14 years old. And if it's a recurrent thing, okay, you can have some form of orchitis. Okay, kaya sinasabi nila, it's, they know it. It's like they were said, it's a sterility. Diba? Sinasabi ninyo lagi, ay pagka lagi ka nagkakamams, mababaog ka. Yeah, so that's what they were trying to say. It can form, but that only occurs it occurs only a small percentage, okay? It's just, if it's persistent, and then that can happen. But if it's once in a while, no, don't worry about it. Yes. I will, Agnel, that's what they call it. Agnel, that's the blue powder that they are putting. So all the Filipinos know it. Me, I just don't know it. Yeah, so it's
slobbering everywhere, Mom.
Yeah, I'm sorry. So I will do my research. Yeah, so thank you very much for telling me that. So I will do my research on mumps or Agnel, that's what they are trying to say. Okay, so another childhood illness. So this one, Kyla had this, and I remember she was very young. She had a fever, and it was high fever up until 39 degrees Celsius. I don't know what that is in Fahrenheit.
Hot.
So 39.5, it was so high. She had fever, persistent fever for 3 days. And after that, it was gone. The fever was gone. But then, there was a skin lesion that came out. And it's also a viral infection. You call that erythema, it's exanthem subitum or Rubella infantum. And again, these are mild viral infection. And after that, you just do hydration. That's the most important thing to do is you do hydration. And the most important thing is to have a very strong immune system. So if you have a strong immune system, and this all viral infection will just go away eventually.
Don't you say that basically if you treat these, they take about 7 days to clear up, and left untreated, that takes about a week?
Yes, they're basically the same. Yeah. So again, just to wrap up about common childhood illnesses, it's very important to have a strong immune system. And what you can do to have a strong immune system is to take vitamin A. So vitamin A, vitamin C, and zinc. Okay. Also magnesium. Magnesium can help with to build up a very strong immune system to fight all of those offending organisms. So that's how that's the end for our infectious diseases. I hope you enjoyed. Yes, go. Okay. So again, we're gonna go say hello, and after that, we're gonna be answering some of your questions.
You had a big announcement already, Mom.
Okay. Your big announcement first.
All right. Basically, we received word, I believe 2 days ago, that Amazon, which is almost the second largest retailer in the world, has now approved Boston Sea and other Dr. Farrah products for worldwide shipping. So from Amazon.com, no matter where you are in the world at this point, I believe, you might have trouble if you're in Antarctica, but virtually anywhere else in the world, you can buy Dr. Farrah products and have them shipped to you from Amazon.com.
Yeah. Okay, that's good news.
So the folks from Japan, the folks from Malaysia, folks from France, Germany, Netherlands, Russia, Romania, everywhere else, Italy, Africa.
Yes.
Everywhere else that the folks have been contacting us from, you can just order on Amazon.com now.
Yeah, but we're still looking for some people. If you're interested, for distributorship, we're still looking
Absolutely.
for a lot of people to be a part of our family.
Yeah, you're talking about a significant products that are in high demand, because everything that Dr. Farrah has, you have to understand, she's not just a formulator, she's a clinician. There's a lot of folks out there with products, they're just formulators, and what they look to do is to create highly marketable products that sound really, really awesome, but you have to understand, these people have little to no clinical experience at all. They've seen maybe a handful, maybe a couple hundred, at best maybe 1,000 or 2 patients in their entire medical career, and yet they want to portray themselves as experts, in clinical nutrition and things like that. Many will even go so far as to try and butt up as many letters at the end of their name as they possibly can.
Yes.
I've seen lots of folks do that. And so, but the thing to remember about Dr. Farrah is, like I said, she's not some blind enthusiast here. This is a woman who's, treated over 150,000 people for not only cancer, but numerous other degenerative illnesses. And so everything she does from a formula perspective is from significant experience. Yes. She knows what works, and she knows how to separate the wheat from the chaff.
Yes. Hi to Miss Era Plaza daw. So she's watching from Kuwait while ironing the abaya of her amo, her boss. So hello po sa inyo. Again, Janice Berano, thank you very much. And of course, Christine Lorien Palingkod Jacob. So doing some emojis there. And Mary Joy B. Olivero, okay, just say hello to me. Private message me, or Miss Kenjaya Evangelista, of course. And Chastity Mullins, okay, so she's asking about the diaper rash. Okay, for diaper rash, you can put zinc oxide.
I haven't had that
so
for a while.
So if you have zinc oxide, cornstarch as well. So it's good for them. Just keep it clean. I never had that when we had we have Gabby and
when our kids are small, because you're always very, very good about keeping them very clean.
Yeah, you just have to remove it constantly. When they pee, just remove it. Okay? So again, Clarice Venturina, what is the best treatment for STI, that's sexually transmitted infection? Of course, you know what it is. Abstain.
Abstinence is a fantastic preventative measure.
And be monogamous, okay? But if you had some form of sexually transmitted infection, so you have to go seek, of course, a treatment from a medical doctor or your healthcare provider. But for me, what I usually do, if there's some form of irritation down there, you can do hot sitz bath. That can alleviate with the burning sensation.
And once you get that situation resolved, don't do it again.
Don't do it again. Yes.
Don't do it again.
Yes. Okay, Gloria Pastor, Doc, balakubak problem for my teenage son. Okay, you can apply white vinegar, that's my favorite, and then virgin coconut oil after that. So also aloe vera can help with the dandruff. Yes. Steph Ranyola, allergy rhinitis. My favorite, honey and cinnamon. Of course, 1 tablespoon of honey and a pinch of cinnamon. Put it in water, or you can just drink it 3 times a day. So they're asking about polio. So polio, yes.
I wouldn't call a single case an outbreak. I mean, because the thing is, there are diseases, numerous diseases that have been eliminated officially. Eliminated from the U.S. for decades and decades. Yet
but we do not know. But we do not really know because of some form of problems like with what do you call this? Because what do you call that, honey? I have forgotten my.
No, what I was going to say is
the recording problems.
Yeah,
so usually there's the
reporting issues.
Yeah, the recording and the reporting issues. It's not usually demanding time.
Because the thing is, here in the U.S., you have children who are being diagnosed again with rickets, which is a significant vitamin D deficiency. You're having cases of scurvy pop up, which is significant vitamin C deficiency. You've even had numerous cases of beriberi that have happened.
Yeah. It's all coming back right now.
Yeah, well,
they said that some of the illnesses that have been eradicated, they're all coming back right now. Mm-hmm. And again, in one of the books that I have read, they said that a perfect diet usually wards off all types of ailments. Okay, so that's the thing. That's the key. Is if you have a perfect diet, and perfect diet really they do not exist.
No,
they don't exist right now. So it's always important to be vigilant when it comes to your health.
Like for example, when it comes to supplementation for nutrition, the official stance of Harvard Medical School is the fact that a multivitamin supplement every day is very good health insurance. Mm-hmm. That also comes from the Journal of the American Medical Association. Mm-hmm. Now Harvard, you're talking about the oldest university in the U.S., and the number one university in the world for life sciences and medicine. Mm-hmm. Again, their official stance is to take supplementation daily. Mm-hmm. That is good health insurance. So if someone is telling you that that's not a good idea, I would simply ask them, do you know more than the senior professors at Harvard? Do you know more than Harvard Medical School? Because that kind of flies in the face of what they're saying. And that and the Journal of the American Medical Association says the same thing. So you want to argue with them?
I think everyone is just so scared of the polio right now.
Oh, yeah.
Yeah, I remember my first
encounter.
Mom had polio. Oh, your mom had polio.
Yeah.
But my first encounter with polio was with my classmate in elementary. And I remember he had one leg that is atrophic compared to the other legs. So I didn't know about polio. So we always thought about polio as having something like that, right? Mm-hmm. The other leg is atrophic and the other is okay. Is your mom like that?
I wasn't there.
Mm-hmm. But she's
a little.
But right now, if you look at her right now,
no, she's not.
The other leg is not atrophic, and the other is fine. Okay, so it may or may happen, may or may not happen to you. Again, a very strong immune system is very important. Like what I said, vitamin C, vitamin A, and zinc, they can more or less protect you. Okay, Jehovah is a good God. He has given everything to us. Okay, so again, best food to boost the immune system, Bads Ada Cruz. The best food to boost the immune system, those are rich in vitamin C, vitamin A, zinc, and also magnesium.
I saw one a few minutes ago, Mom. I'm sorry I didn't point it out. One woman was asking. She had her partner had fallen off of a ladder and has a pain in the neck. Obviously, you may want to seek medical attention for that immediately, especially if it's an emergency situation. As well, you may want to consider the care of a chiropractor. Mm-hmm. Because there are those that denigrate the practice of chiropractic, but I am one that absolutely and wholeheartedly promotes it, simply because it provides me personally significant relief for my back.
Yes. So Ems is asking, Doc, where can I buy your book? You can buy my book at National Bookstore and small bookstores. You can also
Mom Terra-Bunch is here.
You can also private message Miss Chi Balmaceda Gutierrez. And if you private message her in Facebook, and she will be able to help you and assist you in that. Okay.
Gadolinium poisoning.
Gadolinium poisoning, please. Where do you get gadolinium? Gadolinium, it's a mineral. Okay. So if you look at the table of elements, you can see there gadolinium. And this is usually seen when you do some diagnostic modality. So, if you had some gadolinium poisoning, the best important thing there to do is that you have to drink foods, you have to use a mega dose vitamin C and magnesium. Okay, so pixie dust, it's the one I always tell my clients. Pixie dust and megadose vitamin C can help you with that. Yes, Lerma David Musni for myoma. So for myoma, you can use the Maria, of course. That's my favorite. Seaweeds and the Boston Sea. Megadose vitamin C and pixie dust. Yes, Kumisol is saying number one. Yes, it's a number one bestseller. It's a bestseller right now. And it has been a bestseller for nine months, almost a year right now. So
hello,
thank
Marissa
you very much.
Gonzalez Ting, watching from London.
Hi, Destiny.
England.
Hi, Destiny Franzen.
Destiny Franzen.
Yes. Deborah Su, your book is wonderful. Thank you. I have written it for the average Filipino people because everyone there has no money, including me.
I've actually,
Yes.
I've spent the past several months working on an article. Unfortunately,
Yeah.
I'm not going to talk about it, but I was working on an article that unfortunately has turned into a book itself.
Yes. So, again, my book, it's available in national bookstores. So thank you very much for all of you. Yes. So, Mary Ann Ramos Gamata, Doc, weak lungs.
June Acuna. Hey, June, Reg.
Yes.
Acuna,
Hi, June Acuna. So, for weak lungs, the ones that I would advise is you can do asparagus, diba? So, I think I did some videos about that where we did some asparagus paste.
Oh, yeah.
And you can eat it like 1 or 4, 6, how many times that you want. And then you can also use my...
You gotta admit though, it's tough to get past the first time.
Yes, but you would love it after that. And then siling labuyo can be used for weak lungs, oregano. Now if you're like me, I used to have asthma, bronchial asthma. What I did was honey and cinnamon. And that's the thing that I give my children as well if they're having fever or they have some form of viral infection. Honey and cinnamon if they are more than 2 years old.
Hello, Del Rosario in Saudi Arabia.
Joyce Rabago. Agoho. How about anxiety disorder? For anxiety disorder, you can use manganese, magnesium. Also, you can use kava plant and the St. John's wort. Yan. So these are the plants that can help you if you're having some anxiety disease. Okay. And of course, prayer. So
Non-calcified nodules in lungs.
So for non-calcified nodules in lungs, the best thing that you can do is pixie dust and megadose vitamin C. There was one testimonial. Did you see that? La Forest, she gave me a testimonial.
Those are non-calcified nodules, weren't they?
No, those are cancer.
Yeah, a little different.
So she took the natural cancer killer recipe that I had. It's in my book for all of you who do not know the recipe. It's all in my book. So just
it's also
go
in the
buy
cancer
it.
patient support group.
Yeah, it's all in the cancer patient support group. So just go there. And then she was taking megadose vitamin C. So from I think 5 cm, so it went to 2 centimeter in just a matter of 2 months. So thank you very much, La Forest, for sharing us your story. It's a wonderful story. You're an inspiration to us. Yes.
You're the inspiration.
Benedict Cortez Bautista for clogged arteries. So for clogged arteries, I think I tackled this like last time with calcium, and I was telling you that high calcium can cause calcification. So, and then this can go to your arteries as well. So chromium, last time, do you remember I was talking about how chromium can help with atherosclerosis.
Yeah, and obviously adopting more of a plant-based diet can significantly help better that situation.
Magnesium can help. Nitrates, yan. So nitrates, this can help as well. And again, lemongrass, garlic, ginger. So you have to have an antiplatelet. That's the one that the doctors would usually give if you have coronary artery disease. They would give you aspirin, diba? So you have a substitute for your aspirin, which can be a garlic or ginger. Ginkgo biloba also.
It's fun to say.
Ginkgo biloba.
Marlene Romero. How about liver cancer, Dr. Farrah?
So for the liver cancer, you can use megadose vitamin C. and also garlic. So one time probably I can make a video about that, about liver cancer.
You have made a lot of videos about liver cancer.
Yeah.
In fact, just so you know, I can remember back when we were in the Philippines. The fellow's name escapes me right now, but the testimonial's up there with his lab results. Because he was coming to you for a checkup, and he's not someone that I had ever met before. And so I'm sitting there chatting with him, talking with him. He's like, yeah, I want to see Dr. Farrah for a check. I'm like, oh, that's great. He said, yeah, I actually, she treated me years ago for liver cancer. I'm like, oh, wow, that's awesome. I said, how did it go? He said, well, I had stage 4 liver cancer, and, it's totally gone. I'm like, what? Awesome. I said, you wouldn't happen to have your lab results with you, would you? He said, matter of fact, I do. And so he pulled them out, and well, his story's up there. Actually, I can't remember his name. Mm-hmm. But it was
Ruben. That's his name, Ruben.
Was it?
Yeah.
It's up on YouTube. It's up on Facebook. But yeah, it was really, really awesome that he just had come back, and this was years later. At the time, I think it was 5 years after the fact that he was declared free of detectable cancer from his lab results. So, and I remember it was a very large liver mass that he had, so that was pretty awesome.
Around 7 centimeters, 7 to 8. Okay, so Primavera is saying, I'm late. Sorry, Doc, hindi na. You're okay, Primavera.
Hey, Primavera,
yes.
How do you like your pasta?
You are okay, yes. So, Pearl Penaso, how about for diabetes? Again, chromium can help. Chromium, magnesium, insulin plant, and serpentina. And of course, you have to change your diet. Okay. Matagal ko nang sinasabi yan. Yes.
One half cream of tartar with juice 1 month taken by my husband every night. What is the effect?
I usually do this 1 half cream of tartar with juice for 1 month if you have arthritis. And this can also be good for stones. Yeah, that's it. That's the effect. So again, what about fatty liver, Doc? Again, I have been tackling this condition for a long time. Fatty liver, it's a first sign of damage to the liver. So you just remove the offending cause. So if you're alcoholic, that can also cause a fatty liver, viral infection, bacterial, parasitic, even cancer. Just remove them. And megadose vitamin C and garlic can help. Also dandelion. So dandelion can help, milk thistle, burdock. Yeah. So these are all the herbs that can help you. Yes. So Eloisa Benavides is continuous po ba ang pagtake ng Boston Sea and Pixie Dust? Thank you. You may continuously take it. It's not gonna be harmful for you.
Hello, Laney and Dave in Canada.
Yes, shout out, saying Lani and Dave from Canada. Yes, hello Miss Lani, hello Mr. Dave. I will see you soon.
Advice for pancreatic cancer. In fact, as I recall, was his name Severino Andalo?
Yes.
Severino Andalo. That was a gentleman from way up north, towards the Ilocos?
Yes, towards Ilocos.
And I believe he was a government employee with stage 4 pancreatic cancer.
Yeah.
That you had treated. And as I recall, he gave us a film testimonial back in like 2017. I think you had treated him back in like 2010.
Yeah, it was a long
2008,
time ago.
2009.
Yeah.
So basically, this was 8, 9, maybe 10 years later. But yeah, his story is up on he's a government employee. His wife's a government employee as well, and he had stage 4 pancreatic cancer, and he was declared many years ago, free of detectable cancer. So basically, by following Dr. Farrah's protocol very directly, here's a fellow who's able to essentially beat pancreatic cancer. So, or as the critics would say, a spontaneous remission.
Yes. So they're asking about Merly Gose Gmail is asking for Hashimoto's thyroiditis. Yes, for
Don't ask for it. You don't want that.
Hashimoto's thyroiditis. Hashimoto's thyroiditis, it's another autoimmune disease, okay, that affects your thyroid. The most important thing there is you can use virgin coconut oil, okay, it's an oil, and then you apply it on your thyroid. So you can also eat seaweeds, and also megadose vitamin C, Boston Sea, and pixie dust. So this may all help you. Yes. Doc, Boston Sea with BC with kidney stones, okay. Yes, they are okay.
Mm-hmm.
Yeah. So, prostate cancer. Okay, prostate cancer. So, this is one of the most friendly, the friendliest cancer to have. So, I was telling my husband back then, if I'm gonna have a cancer and I'm a male, and you're probably gonna be gay. You're like that. So this is the best cancer to have because you have a very good prognosis. Okay, you would live for a long time.
In fact, when I first met my wife, there was a doctor you were treating. His name was Dr. Fortunato. Is it Fortunato?
Salvador, yeah.
Okay, and he had stage 4 prostate cancer with bone metastasis. And as I remember, you had treated him for 44 consecutive days, and then his labs came back as free of detectable cancer.
No, that's a different patient. So anyway.
No, but that was when I first met. You know, the little sweet little doctor with the white hair.
Yes. Okay. Now anyway.
His testimonial's up.
Yes. So you can use serpentina tea, okay, or if you don't have any serpentina, you can use lemongrass. So, you can also use sampalukan, yeah. So, again, you can use Boston C, Megadose Vitamin C, and Pixie Dust. And then you can repeat your PSA after 1 month or an ultrasound after that to see if there's any improvement on your present situation. Yes, ako to Adnerb. Hi, Doc. I'm Brenda watching from Washington. Pwede po ba ako mag-take ng Boston C? Yes, of course. Yes, I will go visit Phil soon. Soon.
When our safety can be assured in the Philippines, you have to understand. One of the reasons we left is that I'm writing an article about it right now. But there were a significant number of death threats that were attributed to senior FDA enforcers, which is why we were forced to flee the country. Yes. We're getting numerous ones. Even as I can recall, as my wife was sitting at the desk of former President of the Philippines and former Mayor Joseph Estrada, as she's sitting across the desk from him, talking with him, she got a death threat via text message. It was, like I said, by NICA, which is the intelligence agency of the Philippines, attributed to senior FDA enforcers. So when we can be assured of safety, then yeah, we'll visit Philippines.
Okay. So, hello to Nick Vargas. Hello po, Sir Nick. I miss you already. As if we are that close. Okay. I just want to say hello just
hello
for
from
a
down
few.
under.
Yes. Ching Tehale. Adenoid cystic carcinoma. OMG. So adenoid cystic carcinoma, Boston C, Megadose Vitamin C, and Pixie Dust may help you with that. Okay. Can I drink wine modestly, like brandy, if I'm taking maintenance medicine?
You know, when
they said that if you drink a small amount of wine, it's good for your
I found back in the day, you know, many 25 years ago, when I drank wine, I wasn't very modest.
Well, there are literature that says it's good for you to drink like a modest amount of wine. But me personally, I don't allow anyone or any of those sick people to drink wine because they have alcohol in it. And alcohol is one of the risk factor in developing some form of cancer.
Like for example, I see people constantly and wildly promoting Guyabano wine.
So someone is asking, do you have a blog?
I may have. I think I have one on the back of my head, right? Don't I?
No,
Do I have a blog back there?
I don't think so. Yes, Vanessa Nicolas Jagorin watching from Bacolod City. Please say hi to my M-boy. Thank you. Hello po. Hi. Yes. So, Shasha. Yes, I already answered that. How to prevent polio. Just watch it again. And Jennifer Calderon. Hi, Dr. Farrah. Watching from Indiana. Wow. So, Churukawa Bell. Good evening, Dr. Farrah. I have osteoarthritis. What food supplements will I take to lessen inflammation? The one that can help you is Boston C. Boston C and Pixie Dust. Yes. So, thank you to all. Hello, Miss Violeta Acob. Yes. Hello po. Watching from Vancouver, BC. Yes, British Columbia.
I have a question.
Yes. Oh, Sir Jack has a question.
Okay, and you guys better get your Google searches ready. All right. This is gonna be a good one. This is gonna be a tough one, but for 5,000 pesos. Many of you are familiar with the actor and director named Sean Penn. He was famous for the movie Fast Times at Ridgemont High, The Game, starring Michael Douglas. He's Oscar-winning actor, famous director. He was in the movie Milk, about Harvey Milk. And he was formerly married to Madonna back in the 1980s. For 5,000 pesos, where, on what, either movie or TV show, in fact, I'll say, what TV show was Sean Penn's first on-screen appearance?
Okay, what's the first TV show?
His first on-screen appearance. What is Sean Penn's first on-screen appearance?
This is for 5,000 pesos.
5,000 pesos.
Yes. So, what is Sean Penn's
Employees of Dr. Farrah and relatives are not eligible to participate.
Yes. Okay.
What is Sean Penn's
first
on-screen appearance in a television program?
Yes. Presi Mitra Cruz, shout out naman, Dr. Farrah. Hello, Presi. Yes, and Josephine Gonzaga Abanilia. Hello, Papua New Guinea. Yes, wala pa po. So you can private message me or Kenjaya Evangelista. So Robert L. Smith, drink tuba, it kills worms. Yes, you're right. Abes Diso, hi Doc, good evening. Yes, Jean Ecalde Millet. So is that right? I am Sam?
Where?
Christy
No,
it's not. Little House.
All right, he lives. Who said that? Marvel Stan.
No, Gay Abby.
Gay Abby, you won 5,000 pesos.
Whoa! Good job.
Gay Abby, you answered just before Marvel Stanley did.
Yes, sorry, Marvel Stanley.
And it was Little House, also known as Little House on the Prairie.
Little House on the Prairie. How old was he when?
He was just a kid. This was back probably around 1970, mid 1970s.
Yes.
We always watched that show when I was a kid.
Yes. Hello, Ma'am Susan Yusi from BDO. Yes. And Nerak, no, you did not win. So
episode 112 of Little House on the Prairie. Wow, that's very specific.
Yes. Okay, so thank you very much
from
again.
December 4th, 1974.
We have to say goodbye now. So thank you very much for watching, and I hope to see you soon. So bye-bye po.
Bye guys, thank you.
Sa inyong lahat.